All right, today we're going to dive into a medical issue that's incredibly common, but one that people don't really like to talk about: acute anal fissures. We're going to break down a really important new study to figure out what they are, how they're treated, and what the long term picture actually looks like. So let me start with a question for you. What painful condition do you think affects more than 1 in 10 of us over the course of our lives? Well, the answer is an anal fissure. Yet this is not some rare, obscure problem, it's surprisingly widespread. So, what is an anal fissure exactly? Put simply, it's a small tear or cut in the very sensitive skin of the anal canal. The best way to think about it is like a paper cut, but in one of the most delicate areas of your body. And, as you can probably imagine, that's what makes it so unbelievably painful. And that pain, it's the number one symptom. The study found that almost 3/4 of patients reported severe pain during bowel movements, and that often comes with a bit of bright red blood, a burning feeling, or itching. Those are the classic signs that send people looking for help. What's really interesting is where these fissures tend to show up. It's not random at all. When a doctor is examining a patient who's lying on their back, that's the lithotomy position, the vast majority, nearly 64%, happen right at the 6 o'clock position. The next most common spot is 12 o'clock. This is all directly tied to the anatomy and blood flow in that specific area. Now, you'd think for something so common, we'd have all the answers, right? Well, not exactly. Good long-term data on how these treatments work out has been pretty hard to come by, and that's exactly where this new research comes in, giving us some of the clearest answers we've ever had. And this was a massive study. They tracked 623 patients for a median of 41 months. That's almost 3.5 years. Some people were followed for over 5 years. That kind of scale is absolutely crucial if you want to understand what really happens with healing and, importantly, recurrence over the long haul. A really key detail here is that the researchers were laser focused on acute fissures. These are the ones where symptoms have been around for less than 6 weeks. They specifically excluded chronic cases, like the ones you see here, which can get more complicated with things like scarring. This was all about getting clean data on that initial phase of the condition. Okay, so how do you actually treat these things? Well, the first approach isn't aggressive. It's not surgical. Instead, doctors go with a gentle, conservative method that's all about helping the body heal itself. And this really gets to the heart of the medical consensus. Non-surgical treatment is safe, and it should always be the go-to first-line treatment. Surgery is really just a backup plan reserved for the few cases that just don't respond to this initial therapy. So this conservative plan has 3 main parts. First up, topical ointments. These are medicated creams that relax the sphincter muscle, which helps increase blood flow to the area and lets it heal. Second, stool regulation. Patients are often advised to use fiber supplements to make sure stool is soft. And third, just general lifestyle advice on diet and drinking enough water to prevent the constipation or diarrhea that might have caused the problem in the first place. The study also compared the 2 most common ointments, and while both worked pretty similarly in terms of healing time, there was one huge difference. Patients using diltiazem were less than half as likely to end up needing surgery compared to those using glyceryl trinitrate. On top of that, diltiazem was just better tolerated, with fewer people reporting side effects like headaches. So the big question is, does this gentle approach actually work? Well, the data is just overwhelmingly clear. Absolutely yes. Let's take a look at these success rates because they are seriously impressive. Okay, this first number is fantastic: 70.5%. That's the percentage of patients who had a perfect recovery. Their fissure healed completely, leaving absolutely no trace, no scarring, nothing. But that's not even the full story. When you include the patients whose fissures healed, but maybe with some minor scarring, the total healing rate shoots up to 88.5%. The bottom line here is that nearly 9 out of 10 patients get better without ever needing surgery. That's a huge win. And for anyone wondering, okay, how long does this take? The study gives us a pretty clear answer. The median time for symptoms to completely go away was 11 weeks. So that gives you a realistic timeline for what to expect. Let's just flip that around for a second. Only 8.7%, less than 1 in 10, of all the patients in this giant study ended up needing an operation. That really drives home how effective this non-surgical approach is as the first and usually the only treatment you'll need. But, and this is a big but, healing isn't the end of the story. The long-term follow-up in the study revealed something incredibly valuable, and that's the real challenge of recurrence.
This right here is the headline finding of the entire study. Even after people healed successfully, nearly 30%, 28.9% to be exact, had it come back at least once during the follow-up period. So healing, it turns out, is not always a one-and-done deal.
And these reoccurrences aren't happening right away. The median time to the first one coming back was almost 2 years after the initial problem. The second one, almost 4 years later. And the third, over 5 years down the line. This shows that for some people, it's a persistent, long-term vulnerability. So what this means is that for patients, even when you feel completely better, the underlying issue might still be lurking. The study's authors really stress that because recurrence is so common and can happen so far down the road, it's critical to stay vigilant and keep in touch with your doctor.
Okay, let's bring this all together. What are the key takeaways from all this research? What does it really mean for you?
Here's the bottom line. First, that conservative, non-surgical treatment is super effective. It works for almost 9 out of 10 people. But, and this is the big one, recurrence is a major issue, affecting almost a third of patients. And since these flare-ups can happen years later, long-term awareness and follow-up are absolutely essential.
And this all leaves us with a final, really crucial question. This research shows that for a lot of people, an acute anal fissure isn't just a one-time event, but more of a chronic vulnerability. So, knowing that, how can doctors and patients work together to manage that risk, long after the initial pain is just a memory? That's the challenge the study really brings to light.